Hello, this is Dr. Bob DeMaria, the Drugless Doctor, and today we're going to talk about body signals. What does that mean, Dr. Bob? We're going to talk about you, looking at you, and we're going to start from the top and we're going to work down to the bottom. I have a chapter in Dr. Bob's Drugless Guide to Balancing Female Hormones just on body signals alone. I want you to start by looking at your hair. Do you have thin hair? Very common in ladies. Thin hair is commonly caused by subpar thyroid function. What about the pupils in your eyes? Do you have large pupils? Does bright sunlight tend to bother your eyes? Do you wear sunglasses? What I found from my experience, large pupils, a body signal for poor functioning adrenal glands. What are the adrenal glands? They are a pair of glands located on top of your kidneys. They're about the size of a walnut. If those adrenal glands are not functioning optimally, you could have a body signal of getting dizzy from a sit to a stand position. You may crave chips, pickles, and olives. You may even be the person whose back goes out easy, or you bend over to pick up something simple like your sock or a piece of paper or a pencil or even your shoe and your back goes out. It could be subpar adrenal gland function. Do you have large pores on your face? Large pores on your face is a body signal to me that you don't have enough zinc in your body. Other body signals for a lack of zinc are white spots on your nails. Imagine that. Look at your fingernails. Some of you haven't seen your fingernails for years because you put fingernail polish on them and you coat them because your nails peel and they chip and they break, which is a body signal. It's a body signal for digestive distress. Do you have wide-spaced teeth? How about yellow teeth? Wide-spaced teeth, yellow teeth, body signal, subpar thyroid function. Watch my shoulder. You see how my shoulder's high on the left-hand side? When somebody comes into my office, if their shoulder is consistently high, I would suspect that they might like to eat carbs or sugar. Say, Dr. Bob, come on. I'm telling you from my experience, when we do diet journals, what happens is that sugar impairs the pancreas, and a part of the pancreas innervation, in other words, where it gets its electrical energy from, is up in that left shoulder blade area. Do you have digestive distress and right shoulder blade pain? Typical with gallbladder complaints. Do you have a metal taste in your mouth? Metal taste is also common with gallbladder distress. How about fungus? Do you have fungus on your toenails? Do you know I've had patients come into my office that have had their toenails taken off because they had a fungus growth that would not go away? But we have found from our experience that people who have fungus challenges tend to have distress in their colon. They usually love sugar. Sugar will allow the unfriendly bacteria and organisms to grow in your body, including fungus, which will precipitate in your toes. Do you have bad breath? Do you have digestive distress and bad breath? It's a body signal to me that what's going on is that you have poor digestion. Here's a very common one. When you go to bed at night and you wake up at 1 or 2 o'clock in the morning, and or are you grinding your teeth, oftentimes that's a body signal of something very serious, which is parasite challenge. And there's a blood test that we do called a complete blood count, a CBC with a differential. We look for a particular kind of white blood cell called the eosinophil. And if that's elevated, we suspect that that individual may have some parasite challenge and we treat accordingly. If you go to bed at night, let's say you go to bed at 10 o'clock and you have challenges falling asleep and you also have freckles, nothing wrong with freckles, but people who have freckles tend to have high copper. People who have high copper tend to have a little bit of electrical aggravation in their brain at night. Their brain's going 100 miles an hour, and they have a challenge falling asleep. Let's say you go to sleep at 10 o'clock, but you wake up at 11. You may want to consider some B vitamins. That's Bravo vitamins, because what I have found from my experience, people who lack B vitamins might wake up 1 or 2 o'clock or 1 or 2 hours after they fall asleep. Talking about B vitamins, people who cry easy, which is so common today, people will come into my office and they just cry. They tend to have a B vitamin need. That means that they need B vitamins, and those B vitamins alone, from my experience, help take away that feeling of having high emotions. Does your skin itch? Itchy skin is also a body signal to me. You might be either taking too much vitamin D, and I usually recommend between 2,000 and 4,000 international units a day after we've done a vitamin D3 blood spot test. If you do in fact have low vitamin D, you may need calcium to supplement the vitamin D also. Skin itching is a very common body signal for lack of calcium. Taking too much vitamin D can cause that to occur. And also I've had individuals who have come into our practice that had hoarseness in their throat. Hoarseness in their throat can be caused by an enlarged parathyroid gland. And that parathyroid gland is often caused by lack of vitamin D. Do you have difficulty in swallowing? Do you get nervous when you swallow? It's a body signal to me, once again, that your body is deficient in something. In this particular case, it would be potassium. A great source of potassium, besides bananas, are avocados. I encourage our patients to consume at least a fourth of an avocado every day. Avocado has a great source of protein. It's a great source of fat. It'll help your body all the way around. Here's what I'm going to suggest to you. Analyze some of the body signals that you have. You might want to pick up a copy of Dr. Bob's Drugless Guide to Balancing Female Hormones. Go to the chapter. Become your own detective. Because see, those body signals are literally a report card of what's going on inside of you. And if you make appropriate necessary lifestyle changes, those body signals will go away. If you just follow a few of these steps, I promise you, your body will be glad you did.